Also watch House. I would recommend watching House. I'm currently I'm watching Crypto. You've studied Lishman. Yes, you've studied it will end here.
And also one thing, remember, you won't be a student forever. Like you need this knowledge for a point in your life. So when you get familiar with it, I feel like there are just certain things that you will not even need to study. Hi guys, welcome back to my YouTube channel. It's your girl Precious and I'm back again with another video. This was supposed to be one video, the previous one, but because of the time, we've split it. So
no, we love you guys. We just had to make a part 2.
The part 2. This is the part 2. I'm back with the collab. Please introduce yourself.
What's up, guys? My name is Tananani.
Yeah, and she's a YouTuber.
Oh
as
yeah,
well.
yeah, that too.
Medical content, guys. If you need motivation in your life, you need a relax, a breather. I like how her content is very raw. Like I feel like you don't rehearse, you just sit down and record.
I just sit down and record. There's no time.
There's no time for rehearsing.
Yeah.
So I'll put all her details in the description. Please go subscribe, support a sister. And yeah, you know the vibes, exactly. So for today in this video, oh by the way, I've not welcomed you. If you're a first time, please subscribe to the channel. My name is Precious. I do content on medicine, just like her. And I just take you along my life. Anything interesting, I literally drag you guys along. And if it's your returning subscriber, yeah, you are the one.
You are Ruby MVP.
You're the one we salute.
Yes. Yes, because then why are you watching? You're not subscribed. What are you doing?
Hey, those of you who watch and don't subscribe, that's the plan.
I really don't
That's the plan. Like,
create a Google account.
Exactly.
That makes sense.
It doesn't take long. It's just your Gmail, shiny. Subscribe. You support. Like actually, your likes also make a lot.
Exactly, and your comments.
Yeah,
we
comments.
want to know how the video is.
It always feels good to read comments from people. I enjoy reading comments.
Yeah.
When I release a video, that's what I look forward to. Replying to comments.
Yeah.
But anyway, so today we're going to be talking about tips for your rotations. So if you are a student who's doing your preclinicals, or you are a student like me who's in China right now and going to come back and rotate in Zambia or any of your home countries, this is the video for you.
Yeah.
You are in the right place.
Your go-to. In one video.
Yes, yeah, and it will have, I'm sure by the time you leave this video, you'll be loaded with everything that you need.
Yeah.
So we're talking about tips that you need for rotation. What do you like? Yeah, what do you need to look out for? What do you need? What should you pay attention to? And as we start, just open the floor. The first thing is you need a notebook and a pen.
And comfortable shoes.
Yeah, oh yeah, comfortable shoes. Comfortable shoes, a pair of scrubs.
And strength.
Motivation.
Let's not lie to them. And strength.
Motivation, guys, to keep going.
Yeah.
You need the motivation. Motivation. But yeah, otherwise we're going to go rotation by rotation. Yeah, rotation by rotation. So we're going to start with IMED and surgery. Obs and Gyn and surgery. We'll combine the two because it's like the same thing.
Yeah.
Same but not same.
What you guys didn't know, Obs and Gyn has my heart. That's
really?
where I'm actually looking to specialize in. But we're just praying. Girl.
I didn't know she was like me. Like I think it's a place that I would see myself.
I'll see myself there. It's hectic, but I'll see myself there. So yeah, Obs and Gyn, what do you need?
Okay, so Obs and Gyn, number one, be hands-on.
Be
hands-on. That's one thing I didn't do actually. I remember, I watched a number of VEs and I was very, what's going on? But don't be shocked. Like, wear the gloves. And sometimes, some doctors, it may look like they don't need help, but just wear the gloves. I think that's a tip wherever there's something surgical going on. Like, don't wait to be told, wear the gloves. Just wear the gloves.
Stand. Even if you're just passing something, you retain the thing.
Yeah, and it's easy for you to remember. And also one thing, remember, you won't be a student forever. Like you need this knowledge for a point in your life. So when you get familiar with it, I feel like there's just certain things that you will not even need to study. So like, okay, how to do VE and all that stuff. But yeah, I think that's another one tip.
Obs and Gyn is a very what can I say? Like mechanical type of rotation, surgical specialty. They have a lot of protocols. Hence the thinking. You think, yes, but it's not like the way you think in internal medicine.
Yeah.
So that's why we're saying be hands-on, because the things are there. It's not like internal medicine where you have to look for what's the problem. The problem has come to you in Obs and Gyn. The woman is in a PPH. So it's a protocol. What do you do in a PPH?
Oh, yes.
And if you are not on the ward, in obs and gynae surgery, if you are not on the ward, you are not assisting, you are not reading. Oh my God.
Forget about it.
You might as well sleep.
Forget about
Just
it.
stop medicine. Yeah.
But yeah, I think what she said is so true. Because I remember even surgery, like you said, like you don't have to start looking for. Oh, you need to think. But surgery is like
the person will come with a fracture. There's nothing.
Yeah.
You start thinking that the pathophysiologist. Calm down.
So exactly. So if you decide to be a spectator,
yeah,
you end up discovering that you're a spectator throughout. Because
I think even just in all rotations, try to push yourself to the front. It's hard because you're like, hey, me, they'll pick on me all the time. But if you remain in the back, you'll be the intern in the back who cannot calculate, who cannot do anything. You will be in the back. You'll be in the back.
Exactly.
Yeah, so push yourself.
And another thing that I realized, okay, this is a truth that I think we all know in our hearts but don't want to admit, is when you're in the forefront of doing something, you make mistakes, but at the end of the day, you go knowing. You'll be embarrassed in front of your classmates and doctors and all that, but that's something that you will never forget.
Yeah, you'll be the only one that learns.
Yes.
Yeah.
If there's a group of you and you are the one who stands out bravely to do something, trust me, what you've gained are not the person who was watching. You can be told to clerk. The person who's writing has gained way more than you was just standing and watching, even though you were there. So there's in medicine, there's just something about being hands-on. Yeah, so be hands-on.
Also, in obs and gynae, I would say look for, like in every rotation, look for that one doctor that really teaches.
Yeah.
They are there. You just have to find them.
Yeah.
And go on rounds with that doctor. As much as they're there to teach you, their first service is to the patient. So you need to realize that the patient is the core of why everyone is at the hospital. So don't be like, these doctors don't teach. Sometimes teaching is not always talking. Observe. Just see what you can learn certain things, especially in surgical specialties. As aseptic technique is something students, oh my God, you enter in theater, you start touching everything. You wear the scrubs outside. I'm just like,
I cringe.
Then you wonder why there's so many like sepsis after surgery. Like you brought the bacteria. Like so just also be vigilant. Yeah, that's what I would say for surgical specialties.
Yeah, I think be very observant, because I totally remember that where like something someone doesn't have to tell you. Like, oh, don't touch the table, it's sterile. Don't do that, it's sterile. This observe. Don't just come and be like you are the master of the place.
Is walking in like this now. You want to start now bumping into.
Yeah, so observe, be observant. Some things you don't need someone to be shouting at you to tell you. So I think that's for obs and gynae.
Yeah.
Then we move on to peds and internal medicine.
Yeah, data. Those you need to read. You need to think and you need to read, because you're looking. It's like a case.
Yeah.
You're trying to solve the case. Also, watch House. I would recommend watching House. I'm watching House, and it makes a lot of sense.
Really?
Like, it really does make. Don't watch Grey's Anatomy. Maybe unless you're in surgery, but that makes sense. Okay? Yeah. So like, have a little notebook and clerk patients. I would say clerk patients.
Oh yeah, clerk patients. That's a big one.
And you know what you do is, like, if you have a major one on Wednesday, if you clerk the patient on Monday, you go home, you read on the topic, then come back on Tuesday and ask the questions that you did not ask. So that when you present, they can even see that you asked the risk factors. Don't clerk patients. It's only now that I learned that, we learn these rubrics like presenting complaint, history of presenting complaint, and what. But then you're not asking the questions that will lead you to the diagnosis. Like, that's what they want to hear. They want to hear that if it's peptic ulcer disease, you're going to ask the risk factor. You're not going to start now asking, so he lives in a 4-bedroom house, ventilated, with what? What's the relevance? We get it, yes, but what's the relevance? You know what I mean? Yeah, so you need to also be on the one to pick up those things, because we look at like the junior residents, medical officers, histories, and like, this is so little. It's because they have the data, they don't need to write everything. They're already the doctors, you know what I mean? But you as a student, oh my God, you need to give us everything. You need to write everything. Yeah.
They drink tap water.
Tap water.
actually for a long time, like I've rotated for a while. Like I realized that for us medical students, we just like going through the template of the history.
Exactly. We're not thinking.
Yeah, we're not thinking. We don't really think. Like the last part of clerking, they ask if they drink tap water. I never know the relevance of that. I just used to ask. Till I discovered, I'm like, some diseases have to do with what water you drink.
Exactly.
Like that's the reason you ask. So there's some times where those questions aren't relevant.
They're not
relevant. I leave them out. I'm just like, if you shout at me, shout at me. But it's not relevant to my history.
The relevant questions.
Yeah, ask the relevant questions. But then of course doctors are different. Some will shout at you, hey, because they're a student.
Where are the ventilated windows?
Where are the ventilated windows? But I feel like it helps you like practice. And it's not something you learn in one day. That's one thing with IMED.
It takes
time and practice.
As well, yeah.
Takes time, because even I'm still practicing my clerking.
Same.
I'm still practicing.
Like far from perfect.
I used to think like I know how to do this. Till one day I went to present the history, and the doctor was just like, you are not bringing up
the presented in a seminar.
No.
Oh, okay.
I've just said it's spooky out there.
Also, any chance you get to like meet 7th years from other universities or what, or even fellow 5th years, like don't be afraid to ask for help.
Yeah.
Like just go and be like, okay, guide me. Very nice people. Yeah, people are very nice. They will help you, definitely.
And if you're trying to make friends with universities around, don't come with the "you can't tell me anything" attitude.
Oh, you'll cry.
Okay, well, these are actually your best friends. People who've been around.
You'll cry.
These are your best friends. Mostly also because the things that you concentrate on studying here are what you actually find in the hospitals.
Yeah.
Some of the things we learn are more common in China, not here. Like we don't fight the same battles.
Yeah.
So
you need to now come and now know what you're going to fight.
Exactly. And then if you are also foreign trained and you hear like, oh no, this other school, like they're having classes, follow. Like follow. I know I should take that advice myself. But follow.
Follow, mama,
follow. Like make a friend and be like, okay, when you go for a class, please carry me with you. I want to go and learn.
But so back to PIDS and IMED, I would say get like the list of common topics. You need to have that. I feel like that's the first thing to all the rotations. Just get the list of common topics, and as you go by, just keep ticking the ones that you've actually read or the ones that you've at least had a class on or discussed. And I'm sure you would have at least grasped one or two.
Someone said something today that stuck. They said the goal is to study smart and not study everything.
Yeah.
That's IMED.
Yeah.
If you want to know everything and study everything in detail,
you will fail.
You will find the ditch.
Because they will come and ask you crypto. You've studied Lishman. Yes, you've studied what? It will end in tears.
Exactly.
They'll ask you how do you do a lumbar puncture if you've studied. Oh,
exactly. And I think for procedures, you can study the procedure, but actually watch one and
assist.
Observe. Assist. Start with assist, then try on your own. And for like topics to study, PIDS and IMED, there are so many topics. So what you do is, we say this already, but on the word, what are you saying a lot? For example, as she said, meningitis is a very like broad topic, but then you find the one that's constantly saying is crypto. Okay, why? Why is it crypto? So you concentrate on studying crypto, but those are
and IMED and PIDS are also like sort of similar in the sense that the topics you see in IMED are also the topics you see in PIDS. So it's just because it's different ages, okay? So like kids and older people, but you sort of study the certain things. You just need to know the difference because like kids are not like mini humans, so they also have their own approach, right? As well as, but like certain things are similar, like it's almost sort of the same. So at least once you've gone through IMED and PIDS and your foundation is strong in one, you sort of just relate it to the next one. Like, okay, so what do I do now for another one? What do I do for a kid?
Yeah, but otherwise writing, and I think also another thing is clerk. Even if you're not presenting, still clerk. I feel like when you clerk, it's hard to forget the disease.
Yeah, because when you clerk, you study that disease.
And you put your face to it. Like, I dealt with this person who had this. I saw them recover and all that. And another thing that we're actually talking before I started this video, because I'm seeing time is really going. But was divide your time well. Divide your time.
You spend the whole time. You're not on payroll. I feel like I said this a little bit. You are not being paid. Do you get it?
I feel like she's talking to me because I feel like that's one thing I didn't do well. Like you go and spend so much. Like have a balance in the hospital. If you are like, I'm not saying go 1 day a week.
No.
But like the time that you spend, really watch it. Make sure you have time to still go home and study.
Let me just give it a for example. Let's say you're on a ward round and there's maybe over 50 students by the bedside of a patient. You can't even hear what the doctor is saying. Politely just excuse yourself. Go to like a room that you can study in and read a topic. Or go home and read. Because what's the point of standing? So that when you go home you're tired, you won't even study. Yeah.
It's like have you been seeing this meme? As medical student, they get home went for lunch for 3 hours. And then
don't eat in Shima. Don't eat in Shima for lunch.
But Shima is nice.
No, if you eat in Shima for lunch, you sleep definitely. I would say on call they eat in Shima in the morning. If you're one of those people, you need strength.
You need strength. Code day. I used to think people were joking when they say they ate Shima this morning. I express code day. When your legs start feeling like they're spaghetti.
Oh, hyper JQs.
And then you're like, how is the doctor who's actually having to think on every patient? How are they managing? Me, who's actually just helping, I'm tired. But yeah, guys, that's basically, I'm sure with these tips you will flourish.
Yeah. And I feel like on our channels, we've discussed certain rotations
in depth.
Just go and watch those videos.
Right now, just get popcorn or something, a juice.
Just sit with a book and a pen and start.
Yes, you know the way you binge watch series, binge watch our YouTube channel.
Exactly.
We've got so much medical content, vlogs, story times, everything you ever wish.
Come on, yes.
It's your paradise. It's your Disneyland.
Come on, yes.
I think that's it from us. Yeah. If there's anything else that we haven't said, we'll probably maybe meet up again. Would you like to see this collab again together?
Yeah, comment down below if you'd like to see this collab. Yeah.
We enjoyed meeting up. I've had a good day.
Yeah, shame. It's been a good day.
It's been a good day. And also, we filmed a video on her channel. Please go and watch. It should be linked. It should be everywhere. So from here, that's where you hit. That's like the next video. It's automatic.
It's automatic.
Yeah. But anyway, bye guys. Thank you so much for watching. And thank you so much for coming to my YouTube channel. I really enjoyed it.
I really enjoyed myself. It's nice.
Anyway, guys, it has been. We'll see you in the next video. Bye.